Good morning, Nashville. Welcome to Health News You Can Use. Our guest today is Dr. Leslie Hopkins. Dr. Hopkins is a certified nurse practitioner and director of the Adult Gerontology Primary Care Program at Vanderbilt University School of Nursing. Welcome, Dr. Hopkins.
Thank you, Dan. It's a pleasure to be here today.
Dr. Hopkins is joining us today to talk about an important topic: the safe disposal of home sharps. First, Dr. Hopkins, what are home sharps?
Dan, home sharps are things like syringes with needles and lancets, which are the tiny needles used to prick your finger before you check your blood sugar. Nearly 8 billion medical injections occur each year outside of a medical facility in the United States. Injections are given in homes, workplaces, schools, restaurants, hotels, airports, and other public venues.
Wow. 8 billion injections. Why are we using so many home sharps?
Injectable medications are used to treat such conditions as allergies, diabetes, cancer, HIV, hepatitis, migraine headaches, blood clotting disorders, and infertility.
I see. And how are these home sharps being disposed of currently?
That's a really important question, Dan. According to the Coalition for Safe Community Drug Disposal, 93% of prescription self-injectors dispose of their needles in the trash. Only 4% of those surveyed stated that they placed used needles in a puncture-resistant container, and 3% admit to flushing needles and syringes down the toilet. Needles of unknown origin must be considered as dangerous, possibly infectious, materials. Improper public disposal of such materials heightens the risk of injury and possible infection. Those at risk for injury and infection include employees of waste removal services, recycling plant workers, janitors, housekeeping staff, sewage treatment workers, and even children and pets within the home.
Dr. Hopkins, is this problem going to get worse before it gets better?
It certainly is, Dan. The large number of baby boomers is creating a rapidly aging American population, and needle use tends to increase as age increases. There is an increased prevalence of chronic illnesses associated with needle use in America. Patient care is being pushed more often and more quickly out of medical facilities and into the home. As an example, 21 million Americans have diabetes, and the prevalence is projected to increase 165% over the next 50 years. Tennesseans need to know how to properly dispose of the home sharps they generate at home.
What are we doing in Tennessee to help protect our citizens from accidental needle stick injuries?
Well, not much, Dan. Needles and other sharps discarded in household waste have historically been non-regulated by the state of Tennessee or by federal policy. In Tennessee, there is currently no legislation regarding the penalty for the careless disposal of such potentially harmful medical waste. The state of Tennessee currently allows disposal of sharps in detergent or bleach bottles. These bottles should ideally have a screw on top, be labeled "No Recycling," and can then be placed in the garbage. As a healthcare professional, it is my responsibility to help my patients understand how to properly dispose of needles they use at home. It is the responsibility of all healthcare providers to educate patients about proper disposal. Using thick plastic detergent and bleach bottles is at least a step in the right direction.
So, what can we, as citizens of our great state of Tennessee, do to help the situation?
Due to the staggering numbers, 8 billion needles per year and growing, bleach bottles are not going to be enough. I encourage you to speak to your elected representatives in Tennessee's General Assembly about this under-recognized problem. As an example, recently there were so many syringe needles on the conveyor belts at a Rhode Island recycling plant that conveyor belts were shut down 18 times in one shift so that needles could be safely retrieved. The Rhode Island government is taking steps to develop a statewide recovery program for the proper disposal of residentially generated medical waste, including needles. This type of statewide program would protect the residents of Rhode Island and the environment from the improper disposal of home-generated medical waste and sharps. Perhaps in Tennessee, we need to do something like Rhode Island has done.
This has been very informative, Dr. Hopkins. Thank you for your time. I hope those of you watching at home will take Dr. Hopkins' advice and contact your elected representatives. And if you are not already doing so, start disposing of your home sharps safely. you can protect your loved ones and others from senseless injuries and even infectious diseases. Thank you for joining us today on Health News You Can Use. Be well.